Hello, welcome to the program. I'm Lana Kay. Well, most of you know that we have a heroin epidemic right here in our northern Kentucky. Well, our guest has been on the forefront of the fight against this deadly drug. Please welcome Charlotte Wethington to the program. Welcome, Charlotte.
Thank you, Lana.
I'm so glad to have you with us today. Charlotte is a recovery advocate for Transitions, our drug treatment program located right here in northern Kentucky. So Charlotte, first of all, tell us a little bit about Transitions.
Transitions is a nonprofit charity that provides substance abuse treatment and related services for people who cannot and people who can afford to get treatment. And actually Transitions has been in the area for almost 45 years. We're getting ready to celebrate our 45th anniversary. I came to Transitions almost 10 years ago when Transitions was asked to operate the Men's Recovery Center, apply to operate the Men's Recovery Center in northern Kentucky, which was the Recovery Kentucky Initiative, Lana, that was instituted by Governor Fletcher, Ernie Fletcher. And so there are 2 Recovery Kentucky centers in each congressional district throughout the state, one for men and one for women. And so Transitions operates the Grateful Life Center, which is the Recovery Kentucky Center for Men, and that's located on Madison Pike, or off of Madison Pike, on Pleasure Isle Drive, actually where the old Pleasure Isle swimming pool used to be, Lana, and I'm sure you remember that.
Yes, we all remember that.
So Transitions, I was just amazed at what Transitions offered when I came there, because as a nonprofit charity, we take people from where they are and try to move them into at least some short-term recovery so that they can then move on into long-term recovery. And we start with a non-medical detox unit. We have an intensive outpatient program. We have a residential program for women, and they can have their children with them. We have a residential program for men. We have the Recovery Kentucky Center for Men. Wow. We have transitional housing. We have Oxford houses. We have, just sober living apartments. And our newest addition is our Healthy Newborns House, which allows women to be in a program and also be in a home until they have their babies, and then they can stay in the home for up to 4 months post-delivery. So it's just another way that we can support pregnant women and have healthy babies. And so far we have not had any of our babies have to go to the NICU unit. And it also then allows space in our women's residential addiction program for other women to come in when we can move the pregnant women into their own space. So it's been a real blessing. And Leadership Northern Kentucky, actually, the class of 2014, made a lot of that possible through their donations and their work on the Healthy Newborns House. So we're very grateful to them.
Charlotte, let's go back to August 19, 2002, Charlotte, when you lost your son and only child to a heroin overdose.
Right.
So let's take a look at Casey. This is her darling son, who I think is such a handsome young man and looks so much like her. So Charlotte, you were an advocate then before Casey's overdose? No.
No, I wasn't, Lana. I tell people all the time, I wish I'd started the work sooner. But what people have said to me is that I wasn't ready, I wasn't prepared to do it then, and I really wasn't, because I had not lived the experience. And the experience was pretty painful to go through. Well, it was extremely painful to go through, especially because we couldn't seem to access help for Casey, the kind of treatment that he needed to get into some recovery. We were told that we were trying to make decisions for Casey, that he should make his own decisions, that he had the right to choose whether he wanted treatment or not. What they didn't seem to understand, and when I say they, I'm talking about even our health professionals and the people in the field didn't seem to understand that with heroin addiction, Casey had past the point of being able to make a good decision for himself. And so unless there was an intervention, the disease was going to continue to progress and we were going to lose Casey. The best that we got was that he had to want to, lose enough, and hit bottom. He did all of those three things and he died in the process. And so when Casey died, we wanted to donate his organs so that he could live on. And we were not allowed to do that because he was an IV drug user. So
tell us right there, how did you know there was something, what behavior did you and your husband Jim know Casey's got a problem? How was he? Did he become remote?
Yes.
Yes, okay, that was in there.
That was in there. He was depressed. He, like you said, he would isolate himself. He just
wasn't him.
It wasn't him. And in fact, Lana, the last Christmas that we had with Casey, he said, I don't know who I am anymore. I don't know what I like to do to have fun anymore. I don't know. So he didn't even recognize himself. And, you know, I had suspected some drug use. In fact, you know, I had talked with my husband about him smoking marijuana. And my husband said, oh, no, I don't think he is. And I said, we were in denial long before Casey got there. And denial is don't even notice I am lying.
Right.
But, you know, for a lot of young people, they don't necessarily start out with heroin. They start with other drugs before they get to heroin. Now, unfortunately, what I'm hearing is that a lot of kids are just trying heroin right away.
Right away.
But Casey did not. It was a progression with him. And so anyway, when he passed away, we were not allowed to donate the organs, and I didn't know how we were going to let Casey live on, but I said I think there was a much bigger plan for Casey's life and for my life, because that is when I became a recovery advocate, and before I even knew that that's what I was. I knew that there was some legislation in Florida, it was called the Marchman Act, that allowed for involuntary treatment initiated by the family, relatives, or friends. And so I asked my representative, Tom Kerr, if he would be willing to introduce that kind of legislation in Kentucky, realizing that we wouldn't be setting a precedent. So in 2003, the legislative session, Tom introduced that piece of that bill. It did not pass that first year. I went back to him again in 2004 and asked him if he would be willing to sponsor it the second time, and he did. And with the help of Senator Katie Stein, who suggested that we amend a bill that had already passed out of the House, and Senator Damon Thayer, who was amended our language onto that bill in the Senate, we were able to bring it back to the House, and it passed and became effective July the 13th of 2004. So we just
almost 2 years after Casey's death,
yes.
Almost 2 years almost, it became known as the Matthew Casey Wethington Act for Substance Abuse Intervention.
Right, and so it was 10 years old just this July 13th.
That's right. So it's been, what a necessary and life-saving option this law has become.
Right.
And now looking back, do you and your husband Jim think that if that law were in effect when Casey was using, do you think, because you could have had him put in, do you think it would have saved Casey?
I can't know that, Lana.
But he would have had a chance.
He would have had a chance. And what Casey's law is what it says it is. It's an intervention. It's not a guarantee. It is a tool for parents, relatives, and friends to intervene on a loved one that they fear is at risk of dying from their disease. So it is, well, like I said, what it says it is. It's an intervention.
Okay.
It's not a guarantee.
Okay.
But certainly it does give that person a break from using drugs and gives their brain a chance to begin the healing process, which can take a long time. It's not a short-term fix. It takes time.
But you don't have to just stand by like you did,
right,
knowing he needed to be in-house treatment, and
right,
you can't make him go, and he,
right,
of course, an addict doesn't want to go.
Right.
So this was a wonderful law. I mean, it has helped so many people. I know someone personally, Charlotte, that you helped. Her and her daughter, she is in recovery.
That's
it's wonderful. A day-to-day thing, as
right,
you know,
right,
but she's leading a productive life, and it would not have happened without Casey's Law. That came to be known as Casey's Law, and what a great law it is.
Well, and you know, Lana, Casey did not want to be using. It was a matter of he was not able to process the consequences of his actions. You know, Dr. Volkov, who's the director of NIDA, the National Institute on Drug Abuse, will say that people who are addicted will continue to use despite catastrophic consequences. And overdose is a pretty catastrophic consequence.
Yes.
And Casey didn't just overdose once, he overdosed 3 times. And
Oh,
so,
dear.
you know, but he wasn't processing that. He wasn't weighing what was going to happen. And so without an intervention, his disease just continued to progress.
Okay, now what are the steps for Casey's Law? What do they have to do?
Casey's Law starts with, and this is the brochure for Casey's Law, it starts with filing a petition with the Circuit Clerk's Office, and that petition can be found at Casey's website, which is just caseyslaw.org, no apostrophe in it, just CASEYSLAW.org. When that petition is filed, I suggest that the family has already secured 2 evaluators and made appointments so that when they file the petition, they can let the clerk know who the evaluators are going to be and when the appointments are going to be. Because at that time, if the judge signs off on the petition saying that he or she feels like this person needs and could benefit from treatment and that they are at risk to them, or danger to themselves and to others, then the judge will then sign saying that evaluations are warranted. And at that point, that's all the judge is saying, that 2 evaluations need to be done because this person needs to be assessed to see if they really do need treatment.
Right.
And so once that happens, then a court date is set and has to be set within 14 days. And the person must have the forms back to the evaluation forms back to the court at least 24 hours prior to that court hearing. So at that point in time, when they have a court date, then they need to start making those critical arrangements for where that person will go for detox, because detox is required before they enter a treatment facility, and then where they're going to go for a treatment bed. And therein lies the problem, is finding a treatment bed and finding a detox bed. At Transitions Detox, we have a grand total of 11 beds. So 8 for men and 3 for women. You know there's a list there, right? A waiting list. And the same for the treatment beds. There's always a waiting list there. The one thing that the person must do when they file, they must sign a guarantee of payment that they will pay for the evaluations. They will pay for any court costs, like when the sheriff has to deliver the summons to the individual to appear in court. And they must pay for the treatment if there is a cost for the treatment. That's where the Recovery Kentucky Centers come in, because they were absolutely a godsend, allowing people to have access to treatment that had absolutely no money, because the Recovery Kentucky Centers do not cost anything. The person who goes into treatment, to the recovery center at a certain phase of the program, they get employment and then they pay a percentage of their salary as rent. But initially, they do not have to pay a penny.
So what this law, I mean, had to have saved so many lives, Charlotte. You should be so proud that you pushed this through.
I'll never know, Lana, probably how many lives it has touched.
But we know.
We know that it has.
Know that it has.
Yes.
Okay, now, the next thing she decided to do was, let's talk about Casey's bus. Now, and let's show a picture of it, and I'd also want to include her husband, Jim, who has been at Charlotte's side through everything. Charlotte's the pitch woman, the front man, but Jim is right there with her. And here's a picture of Casey's bus. Charlotte's there behind the door. I hope we're getting this, and Jim is standing on the outside with the picture of Casey.
Jim has always been involved in working on cars his whole life, and so, you know, it's been, I'm sure, a labor of love for Jim to be able to do all the work that he has done on it. Plus, we had some help to do some of the work as well, but I know that he's enjoyed doing that.
Well, Casey's bus was really purchased by Casey with his graduation money, and it came home on a rope. But then Casey got a motor in it. got it going. Charlotte took a ride, and so this was really his bus.
Right.
So now Charlotte, I guess you kept it there all those years.
Yes, yes.
And then, I don't know how it came to you, but you said, you know what? We're
Well,
gonna now
yeah.
use the bus.
I'll tell you how it came to me, Lana, is because I became a part of the Heroin Impact Response Task Force.
Okay.
And we were looking for ways of getting naloxone into the hands of families who had someone that might be at risk of an overdose. And so we were talking about, you know, a mobile unit of some type being able to go into communities where they couldn't necessarily get to our permanent locations, which we have one in Falmouth and one in Covington. And so in order for more people to have access to this training and to the naloxone, we decided a mobile unit would be good. And I thought, well, what better use of Casey's bus, since he died of an overdose, would be to take it out and try to prevent fatal overdoses for other people. Because, you know, the naloxone doesn't prevent someone from an overdose, from having an overdose, but it does prevent someone from having a fatal overdose.
We have to talk, let's get specific now, Charlotte, about there are packets on Casey's bus, and they contain what, Charlotte?
They contain, one, a brochure like this that was provided by Northern Kentucky Hates Heroin. They put these together, and we're so grateful for their help and support in so many ways. They also provided the kits that we are dispensing right now was provided through the fundraising efforts of Northern Kentucky Hates Heroin. And so on the inside, it shows how to put the delivery system together. It also tells about how to recognize an overdose, what actions you need to take, how to prevent an overdose from happening. And then on the back, just in simple terms, number one, call 911 when you know that the person is overdosing, do the rescue breathing, and then give it's called Narcan on here. Naloxone is the generic for Narcan, and Narcan is actually the medication that's given in the emergency rooms.
Right.
But we do not use a needle and syringe. What we use is a delivery system that looks like this, that has two caps, one on each end. The first one that you put on would be the atomizer that's going to go up in the nostril one at a time. And then the other piece would be the vial of the naloxone that screws into the other end of the delivery system. Whoops, it might be nice if I took that cap off. And that screws in until you feel some resistance there. And then you inject one half of the vial into one nostril and then the other half into the other nostril. And it's not critical that it be exact, but it definitely will reverse a fatal overdose. And I was talking to someone today, you know, there might be an instance where it might not reverse the overdose, and that is maybe if there is fentanyl involved in the overdose, and there are instances where heroin is cut with fentanyl. That is why it's so important to call 911
yes.
so that you have the emergency squad coming while you're trying to revive the person with the naloxone. And also, as I was telling Lana before the show, it's critical that for another reason, and that's because the naloxone will wear off after about 30 minutes, and so you need to get them to the emergency room 30 to 45 minutes is what our brochure says, so that they will be under the watchful eye of the folks in the nurses and the doctors in the ER. So it's important that they get there.
Last year alone, 545 emergency patients with heroin overdose were revived with this drug at St. Elizabeth. This drug, Charlotte, has this drug always been available?
I think Narcan has been used for a long time. We were not able to dispense it or to do the training and have a doctor prescribe it until last year, and it was through some legislation that was passed that allowed that to happen. And so, you know, right now we're hoping that the legislation will extend the use of the naloxone into the community so that not just the person who is at risk of an overdose, and that includes, and I might mention this too, Lana, this includes not just people who are addicted to heroin, but people who may be taking a strong opiate for pain medication.
Absolutely.
You know, if they happen to take too much of their medicine, they could
this
have...
will also.
Absolutely. This is an opiate. This is to reverse opiate overdoses.
Okay.
And so what we're hoping is that we can get this expanded into use by, so that they would have it, say, for example, in schools, right next to the first aid kit. Because I've talked to school counselors, and I know that they are concerned about young people coming to school and using in the bathrooms.
Sure.
When someone is not in class, they don't know where they are, they start searching the restrooms because they're afraid someone has overdosed there. How many times have you heard about people overdosing in restaurants in the restroom?
Sure.
So we need these not just in the homes where a person is at risk, but we also need it just out in the community, like I said, as you would have any first aid kit.
Absolutely.
Because this absolutely is first aid for a person who
is an
overdose from an opiate. Yes.
Okay, now 2 doctors who are on the forefront with you, Charlotte, Dr. Mike Kalfas
Yes.
and Jeremy Engel.
Yes.
These 2, they work with the PAR team, and they write prescriptions for the naloxone.
Yes.
Okay, so they are very dedicated and very, very helpful along, you know, in this fight. They
Absolutely.
are so hurt and worried by what they see in this community, which is absolutely heartbreaking and really astounding, because Charlotte and I grew up here, and it was rural here. The small towns were like Mayberries, and to think that we have this type of epidemic right here in our northern Kentucky, it's not, and of course it's nationwide,
Right.
but it's so unbelievable. I mean, those kind of things when we grew up, they happened in Los Angeles and big cities, New York. It's just so unbelievable that it's here.
In fact, Lana, in New York State, there's a mom who is pushing for Casey's Law there, and there's actually a bill draft that we're hoping will pass in 2015. Because, like you said, it's not just in northern Kentucky.
No.
It's not just in Kentucky.
It's a nationwide problem.
It is.
Okay, now Charlotte, the long arm of addiction not only affects the users, but these friends, family. We did a show previously with CASA. This is court-appointed special advocates, and the CASA guest told us of how that system was stressed due to addicted parents who are taken away and children left behind that have no one to advocate for them. So this heroin also, then lately in the Enquirer, there were the babies of heroin addicts and the special care and costs they need. So it just goes on and on, you know, the heartbreak of this addiction. So Charlotte, in closing, your most important thoughts about addiction to the people out there, and can you become addicted the very first time on heroin?
That is what I have heard. That is what I understand that can happen. And, you know, that's the problem. Casey said he knew he was addicted when he ran out of money. People do not realize that they are addicted until they've already crossed the line. You know, I will give anybody that Casey made the choice to use the first time. I will also make the point that he never chose to become addicted. That was not in his plan for his life. I think one of the most important messages that I would like to leave with the audience is that addiction is a disease. It is a chronic, progressive, potentially fatal brain disease. And that up until now, we have not had, and still now, we do not have a system of care, a standard of care for people who have this disease, as we do for other diseases such as diabetes or heart disease or any of the other chronic illnesses that are treated in a doctor's office or a hospital. We need a standard of care for addiction. The people who have this disease need it and deserve it just as much as anyone else needs and deserves quality of care treatment. And the other thing that I would say, you know, when I started speaking, I said I spoke for 2 reasons: to raise awareness about the disease of addiction and to inspire other people to advocacy. So I would like to charge each and every one that's watching today to become an advocate. And the way you can do that is simply talk. Talk about this disease. Make it okay for others to talk about this disease. Because I'm old enough to remember when cancer was whispered. We didn't talk about cancer, but when more people were affected, when more families were affected, people started talking about it, and as a result, there was more funds raised, there were more dollars spent on research, and now we have more people living with cancer than dying from cancer. And I would hope to see that for the disease of addiction. And you know, we have a lot of hurting people out there that are living in secrecy and despair because they are suffering under the shame, stigma, and discrimination that surrounds the disease of addiction. And to eliminate that, to erase that stigma, we need to start talking about it and make it okay for others to do the same.
Well, Casey's bus is rolling, and without a doubt, it will save lives. So I say thank you, Casey, and thank you to Casey's mother. You've been listening to Charlotte Wethington. Her contact information will follow. We have learned so much from you. What a wealth of information you have in that head of yours, Charlotte. So, as always, thank you for watching this important program. Be happy. Keep smiling. I'll see you soon.